This was a 44-year-old homeless person who was brought in by the police after loss of consciousness. As we scroll through this case, we see that there appears to be midline shift at the level of the septum pellucidum. Let's measure that. It measures 7 millimeters and therefore is significant left to right shift. The question is, what is the cause of that left to right shift? Sometimes it could be due to volume loss on the right side due to atrophy, but we are not seeing subarachnoid space dilatation on the right side. As we continue to scroll further superiorly, we're not seeing a parenchymal hematoma. We are seeing some bowing of the falx subtly up anteriorly. You might note that the subarachnoid space overlying the right frontal convexities medially is demonstrated, but not on the left side. So this is a quandary. What is the source of that midline shift? Well, hopefully you would have identified that the juxtacortical white matter, which is going far out to the periphery on the right side and in the occipital region on the left side, does not extend to the periphery as far on the left side. Let me use my magic pen. What I'm talking about is this amount of white matter inward displacement compared to the white matter on the right side is one of the markers for an isodense subdural. And you can see that actually the cortical margin on the left side is located where I've drawn my arrow and my line. Although you do not see a hyperdense collection in this individual, by virtue of the displacement inward of the juxtacortical white matter, the degree of mass effect, and in some cases, the effacement of the sulci, that this patient has an isodense subdural hematoma. Now, this patient may have lost consciousness days ago and been found subsequently, and therefore we could identify this as a subacute in age isodense subdural, or we would check the hematocrit, see whether the patient's anemic, in which case it would be potentially an acute isodense subdural hematoma. No matter what, if we were to measure this, we would find that the collection is 13 millimeters thick, exceeding the 10 millimeters thick criteria for surgical intervention, and that, as well as the 7 millimeters of midline shift, would lead the neurosurgeons to intervene in this patient.